Thank you very much, and I will just get going here and not hopefully cut into your lunch too much by this very broad topic that I'm going to skim over, but will be available for questions and comments afterwards. So I hope to discuss some broad child advocacy concepts, really just skim the surface of some childhood well-being in Michigan, some data about that, and then focus on advocacy needs and efforts on behalf of Michigan children, primarily by the Michigan chapter of the American Academy of Pediatrics. And I don't think I need to sell the idea that environmental, family, and socioeconomic factors all contribute to child health and well-being, and that what we do in our office or hospital clinic is only part, maybe even only a small part, of what impacts child health and well-being. And what I've learned over the years of doing advocacy that really has stuck with me is that decisions are being made about child health without pediatricians or child health providers at the table. And they're being made by people that really have little or no knowledge about child health. And I'm going to talk, a lot of my slides say pediatricians, and I know we have a much broader mix of child health providers here, so please think of this as inclusive of everyone in this room, everyone that's on the front line of caring for children. Your voices are critical in child advocacy. And it's really our stories that put a human face on the broader issues that need to be changed. They make the issues real in a way that the statistics and the fact sheets can't do. We always have those with us when we meet with decision makers, but it's the stories that we tell that they remember. It captures the attention in a way that the statistics cannot. Also, everyone in this room is a credible child health expert. And when you're meeting with decision makers, they are not child health experts, so they need to hear our voices. As I said, the American Academy of Pediatrics has really become my advocacy home. Advocacy is stronger when you are doing it with numbers, when you're doing it with an organization that works in coalitions. And the American Academy of Pediatrics, I really think, is primarily a child advocacy organization, advocating for children's health and well-being in very broad terms, and then advocating for child health providers so that they can take care of children as best they can. So some of the big issues on the AAP agenda right now are addressing bias and discrimination and taking care of physician health and wellness and addressing child poverty in the context of child health. So let's look at some of the statistics about Michigan's children. And I get a lot of my data from the Kids Count Data Center. It's very accessible. They have a lot of different types of child health indicators that can be broken down by age, race, region. They do an overall rank of childhood well-being in the country. And we rank 31 out of 50 states, so in the bottom half. I'm not happy about that. And it's really looking at indicators related to economics, education, health, family, and community. And I think we can all agree these all interplay into a child's health and well-being. And unfortunately, they also dug deeper into the areas of race and ethnicity on what they called the path to opportunity. And this looks at 12 different key indicators. Some of them are health indicators. And Michigan had the worst score in the United States for indicators related to African American children and their path to opportunity. So the point is, we have in Michigan some of the greatest health disparities as in terms of child health and well-being. We have a lot of work to do, but I am confident that we're able to do it. So we'll get back to some of these basic things that a lot of us didn't go to medical school or nursing school to learn about, child poverty. But this is really the basis of a lot of the problems with access or understanding. And we have a lot of poor children in Michigan. And this is just a map of the state. The dark blue are the states with the highest rate of poverty in children. And I show this because here in Southeast Michigan, I often think of child poverty as an urban phenomenon, but it's very clear to see that if you look across the state of Michigan, many of the rural counties have the highest rate of child poverty, and many of the issues there are harder when it comes to access to services. And so the Michigan chapter of the AAP is really trying to understand this better and understand how we can support children across the state and support the providers that are caring for these children across the state. It's an important issue in a lot of areas. And I just want to briefly digress to the federal poverty level itself. In 2018, $25,000 annual income for a family of 4. But this was a measure that was developed in the 1960s, and it was based on the cost of food as it relates to the cost of living. Then the cost of a food basket was about 1/3 of the cost of living for a family. Now it's only about 1/7 of the cost of living. So research from social scientists has said that you really need to be at 200% of the poverty level, or $50,000 for a family of 4, to begin to be able to meet the basic needs of the family. So a lot of the indicators will really be more targeted on low income and poor children. And the low income group is the 100 to 200% poverty level. So if we look at children in that way, and if you can't read all of this, I'll just explain it to you, but this is breaking down low income and poor children by race and ethnicity. And the orange bar, the second one from the left, is African American children. This is from 2013, and I will say these numbers have gotten a little bit better as the economy has improved, but the disparities and the way these bars look are still the same. But in 2013, 73% of the African American or Black children in the state were in low income or poor households. 60% of the Latino or Hispanic children. And overall, the number was 45%. So nearly half the children in our state are growing up in low income or poor households. So we really have to start there if we're really going to improve child health. And we need to be able to speak out to say how this is affecting our families and their ultimate health outcome. And I also wanted to bring up the CS Mott Children's Poll on the top 10 concerns by parents. They do this annually, and I bring this up to say 2 things. Number one, parents' concerns are often different than what our top priorities are. And if you look at different racial and ethnic groups, there are different concerns in different groups. So we need to understand what our parents' needs are too. There's a lot of overlap, and there's a lot of things that may not surprise you. School violence, stress, depression, bullying, cyberbullying. But again, if we go back to what were we trained to do when we went to medical school? Did we think these would be the things coming to us? And how is a child with depression, how is that affecting their chronic health condition? How are these related? I think it's just really important to know these concerns as well. And I think we've all heard about adverse childhood experiences, toxic stress, the exposures in very young children to stressors that release cortisol chronically, and the links to long-term health problems and even life expectancy. So a lot of our advocacy efforts have to really start early in childhood, not only to alleviate these stressors, but also to try to understand resiliency and protective factors. And that's an area of active research that we need to understand and advocate for. So now I'll just get to more of the specifics of what's going on in Michigan right now. These are just a bunch of things that came to mind. I'm sure you could add to the list of important issues that may come up in your practice. And I also know there's a few attendants that aren't from Michigan, and I apologize, but I also suspect these are issues in your state as well. I'm going to skim the surface of some of them, dive a little deeper into some, and not touch on any. I just can't do it all. But again, please approach me afterwards if you have any comments, questions, feedback about any of these issues, or an interest in getting involved. And I'll talk about legislative advocacy, but because that's where we go with a lot of our advocacy on these issues, because many are related to very specific bills in the legislature. And I have to give a shout out to the residents, to pediatric trainees, because there is a passionate group of trainees that are getting involved and very activated about advocacy in their practices in the future. This is a group of about 50 residents that represented every pediatric residency in the state. About 3 weeks ago, we went to Lansing as part of the Michigan AAP Advocacy Day. And we asked them to choose a topic that they're passionate about to talk to their legislators about. And then we also give them a topic that we want every one of them to talk about at their visits. And so I'll talk about that a little bit more later, too. But first, I'm going to talk just about the fundamental start of all of this, which is access to care. And this has really been a big federal advocacy initiative, not only for the AAP, but I think all childhood health care providers. Public coverage is a critical health insurance for children. So in 2016, we had almost 2.2 million children living in Michigan, and during that year, 1.2 million of them had Medicaid insurance for at least part of the year. 80-something thousand had CHIP, or Children's Special Health Care Insurance, called My Child in Michigan. There is some good news in all this talk, and one of the pieces of good news is that we have, in Michigan, 97% of the children have health insurance, which is an historic high. We have been a state that has been very dedicated to find eligible kids and get them on insurance, which is not true in every state. So we need to remember that. Most kids have health insurance. We want to find the last 3%, but we're doing well in that regard. Does that mean they have access to care? Not necessarily, but it's a start. But are these programs at risk? So there was unprecedented amount of advocacy to get the extension of the CHIP program back in January, and I wouldn't be surprised if many of you were a part of that. And the federal AAP staff said they've never seen advocacy like this from the pediatric healthcare community ever. And part of it is due to pediatric trainees, early career physicians who have helped us become more savvy at the use of social media, YouTube, but there really was an outpouring that they feel was the difference maker to get this to the table and get the vote. I know there's been stuff in the news this week about whether some of that money will be used to help the deficit. I don't know any details about that. I think this is sound. I think the funding for the next decade will be sound. But what I worry about a little bit is the shift to Medicaid. And there will continue to be attacks on the Medicaid program. And I'm a little bit worried that decision makers will think we've taken care of the children. But I keep coming back to the point, 1.2 million children in Michigan, Medicaid, 80-something thousand CHIP. We need to make sure that decision makers know how important Medicaid is for children. This is the point I want to make with this slide is just to show you that on the left bar, you see that children are almost half of the Medicaid recipients, but on the right bar, they're only 20% of the cost. So what our message needs to be to decision makers is this is an essential program for children. They're cheaper to insure than adults, and our focus is prevention. So advocacy points. CHIP extension was an important victory for children, but Medicaid covers many more children. The good news is we have a very high rate of insured children in our state. Child passenger safety is another issue that's very active, and I think we have a really good chance this legislative session of passing a child passenger safety bill that will update our outdated bill. It has failed. It has died in the last 2 legislative sessions. This is the 3rd time it's been introduced. If it isn't passed by December 31st, it will die again, and the process will have to start all over. It has gone through the whole legislative process and is waiting for a vote in the Senate. That's up to the Senate Majority Leader, whether he'll hold a vote or not. I don't know why he wouldn't. But we're continuing to say this is very important for our state. And again, advocates have been really helpful in pushing this bill forward. This is just an overview of what the bill does. You know, we've been advising patients since 2011 to keep kids rear-facing till they're 2 years old. Our Michigan law still doesn't reflect that. These are guidelines that would really change that, but also move more towards weight-based guidelines instead of age, because we all know what a wide range of size there is at different ages. And advocacy efforts have talked to legislators. A lot of legislators are grandparents and haven't used a car seat in decades, or are young and don't even have children. So it's been surprising the lack of knowledge about this topic. So residents and pediatricians and child health providers have gone and spoken to legislators about things like the different body proportions that children have at different ages, or have shown YouTube videos of crash testing and what the head does when you're an infant if you're forward-facing versus rear-facing upon an impact. And that's been really, really effective at getting the attention. So in terms of the child passenger safety advocacy, our laws are outdated. We have a bill that would update existing laws, which is about saving lives. And the current car seats will still be adequate. And I put those last two bullet points in because a lot of the pushback we get is about government overreach, parents know best about their children, and will this cost more money for families? So we've had to say to them, no, we already have a law, this just makes the law better. And that we don't need parents to buy new seats, they just might use the ones they have slightly differently. Vaccinations. I think everyone probably deals with this issue. And it's a really important one, and it's been a very active one in the state, and it will continue to be, I imagine, because we have a very well-organized anti-vaccination community in Michigan. So I have empathy for this. Parents now are much less likely to see the diseases that we prevent. And we no longer have lines of people with their sleeve rolled up wanting their vaccinations, like what happened during the polio epidemic. We have a lot of misinformation and public figures saying confusing things. And I will step back and say, this is nonpartisan. I'm not putting these quotes up here to be inflammatory. They are just quotes from the 2016 presidential election, some by physicians that are confusing and going against recommendations for vaccine schedules and safety. So parents are confused. There's anxiety. There are still lingering concerns, even though they've strongly been disproved, between associations of vaccines and developmental and health issues. And there's an increasing number of injections as we can prevent more deadly infections. But just back in 2014, we were the 4th highest state in the nation for vaccine exemptions. And part of that is because we have all 3 types of vaccine exemptions: medical, religious, and philosophical. And these are just counties in the state. Again, the darker colors are counties that had the highest vaccine exemption rates. And this is one of those, I guess, ironic situations where a lot of more affluent, educated families are in some of the pockets of the highest under-immunization. So in 2015, the rule by the Michigan Department of Health and Human Services was enacted to mandate that families have to go to the health department to receive education about vaccines and about their concerns at certain points in entry to daycare and school. And then the non-medical vaccine exemption could be signed at the health department, but nowhere else. It's been effective, but since that rule was put in place, there's been a very concerted effort by the anti-vaccination community to overturn the rule. They feel like they know about the vaccines and that it's inconvenient to have to go to the health department. And But again, the statistics tell the story. It has been effective. The way it's probably been effective is because there were a lot of families that were signing waivers out of convenience. They could sign it in the school office, and their child could attend school. We call those convenience waivers. They really didn't have an objection to vaccination. And it's those convenience waiver families that are saying, well, rather than go to the health department, I'll just go to my pediatrician or my child health provider and get my vaccines. So, but that's been effective. And so we need to keep working on that. The AAP is part of a coalition called the Parent Information Network. And if you haven't been on this website, I would strongly urge you to go to it, ivaccinate.org. Refer your parents to it, but take a look at it first. It's really great, and it has a lot of good information. It has little videos about how herd immunity works. And so this has been part of the advocacy effort to promote vaccination in the state. So I think for the bullet points for vaccine advocacy, keep the message simple and direct. Vaccines are safe, effective, and save lives. There are credible resources available, and Michigan's administrative rule has worked to decrease waivers, which means we've increased our vaccination rates, which means we're protecting more children that can't get vaccinated. Our decision makers need to keep hearing that message over and over again. Not to mention the fact that the vast majority of families still choose to immunize, and that's true everywhere in the state. Environmental toxins, I'm not going to go into very much. We all know about the Flint situation that's ongoing, but I wanted to remind you that lead exposure for most children in the state is still from the lead paint in older homes. The population lead levels are decreasing, but many children still don't get tested. And funding outside of the Flint area for both lead investigations and lead abatement of homes has decreased. The map on the right is just showing you for children under 6, this is from 2013 state data, the parts of the state where the blue is representing the number of children that had lead levels greater than 5 micrograms per deciliter. So many Michigan children are still being exposed from both the water, but more from lead paint in older homes. There are known adverse long-term side effects on development and behavior that aren't reversible. And just to segue from, that's one environmental toxin, the question about air pollution and asthma or water quality and how potential pollutants could affect the development of children long-term are big questions in our state that we as advocates have to address. Teen death rates are in this order, and this is 15 to 19-year-olds. Still, the highest is from accidents, second from disease, third and fourth are homicide and suicide. The point to make in this slide, however, is that as accident and death rates continue to decline, homicide and suicide rates are continuing to rise. And we can't talk about homicide and suicide without addressing firearms. It's a very divisive, emotional issue, but the AAP has been advocating for firearm safety for decades. Stronger gun laws, opposing legislation that weakens gun laws, violence prevention, research, physician counseling, the ability for child health providers to ask if there's a gun in the home and to talk about safe storage, mental health access. And this was the issue that we asked all the residents on Resident Advocacy Day to address. There is a bill in the House of Michigan called a red flag law or extreme risk protection order that would be a bill that would allow someone to go before a judge, a relative or a spouse of a person who might be at harm to him or herself or others, and it would give the police the ability to seize a firearm or prevent purchase of a firearm for someone that's deemed a danger for up to 1 year. Very carefully laid out, but it's sitting in a committee, and I don't think there's a strong will to have a hearing on this bill or to continue to move this bill forward. The Michigan AAP did commission a survey in the state to try to get a sense of voter sentiment about a bill such as this. And you can see that 70% supported such type of legislation. And when they looked at the respondents, the 600 phone respondents, and broke them down by gender, age, where they lived in the state, what party they were affiliated with, it didn't matter how you looked at the information. Most people still supported this legislation. For firearm advocacy, the language we use is very important. Gun safety, firearm violence, prevention and reduction, not gun control or regulation, or the door closes in the conversation. We are nonpartisan. The AAP is nonpartisan. We're in it because we want to keep children safe. We want to reduce gun-related injury and death in children and teens. That's why we're advocating. We need mental health access and services, but it's not enough. And we need to find areas of common ground where we can at least start to have the conversation. We need to tell our stories, and we need to support those young advocates that are out there that can't vote yet. We have a lot of depression in the state. This is 32% of Michigan high school students identified being sad or feeling hopeless in the last 12 months. We talked about the suicide rates, and I just want to direct your attention to the left-sided bars, which are 15 to 24-year-olds. The dark orange are Michigan age range, in that age range. The lighter yellow is nationally. So the point is we have rising suicide rates, and Michigan is higher than the nation as a whole. So we need to keep talking about mental health as a component of overall health. We need to support access programs to child psychiatry. And if your county, you might be a county that is part of the MC3 program through the U of M Depression, that should say center. But it's a growing way to get phone consultation about difficult mental health cases that you have if you don't have access to mental health services. And we need to support payment models that allow integration of behavioral health into our clinics. And then I'm just going to end with this. Just when you think you know all the advocacy issues at hand, something else pops up. So we talk about tobacco exposure. We may even be talking about e-cigarettes, but are we asking our teens if they Juul? Do you know about Juul? Juul is one brand of an electronic cigarette that looks cool. It looks like a USB flash drive. It comes in child or youth attractive flavors. You can get decals to personalize it. And yet, at the same time, we're learning that e-cigarette use is on the uptake, and that there is a link to future tobacco use if you are starting e-cigarette use when you're young, and that a lot of people who wouldn't have been tobacco users are picking this up. And this is just showing the Juul brand's market share in the last year. They're the red line. This is really on the rise. The FDA is aware of it, the AAP is aware of it, but how are we going to advocate? Part of it is just starting to ask. Make sure you're asking about this specific topic. So I'm going to end and just say, in summary, nearly half of the children in Michigan, again, are growing up in poor and low-income homes, but 97% of them have health insurance. We know huge disparities exist on the path to opportunity in Michigan, and I know we can do better for Michigan children. We, as pediatricians and child health advocates, with the stories only we can share, are powerful, trusted, and essential advocates. So I welcome you to get involved with the state chapter, to do anything large or small, to talk to me about how you could get involved further. And I will just say, I am hopeful. I really am hopeful. I have worked a lot with pediatric residencies. Their level of enthusiasm, their level of engagement, and their desire to be advocates is really humbling. So thank you for your attention and holding off on lunch to listen to me talk about this.